Hello everyone, I am Dr. Dilip, Director of Children's Anesthesia Services, working in Mumbai. Today, I am going to teach practical approach how we should take the peripheral venous access in infant, in neonate and in children. As all of us we know that in infant and in children, cannulating a vein itself is a difficult task. There are no um, fixed guidelines or a fixed approach to make how to do a peripheral venous access. But in my presentation, I'm going to talk on my practical approach or my experience, what we do in our institute. It is important to know the size of the cannula, in which age group we should use which size of the cannulas. As you can see on the screen, the extreme left, which is the violet one, the size of this cannula is 26 gauge cannula. We should use this one in extremely preterm babies or premature babies when you want to do a cannulation. The middle one is a 24 gauge cannula, which should be used in neonatal and infant age group. And the 22 gauge is used in the blue one, which is used in a bigger size or bigger children. We should use this size of the cannula because it is an important thing that we should be aware of what are the sizes of the cannulas are available in the pediatric patient. So coming straight away to the video presentation, this in a 2-year-old child, how we should take an IV cannulation. There are a few important steps we should be aware while taking the IV cannulation. You can see this hand, the assistant is an important thing when you do IV cannulation because the assistant can give you a good counter traction when you are doing the procedure. So this was the video. You can see the assistant has given a proper counter traction, and with little bit gentle tap, you are able to visualize the vein. So this vein has become a prominent in this one. So again, in this one, what I'm using is 22 gauge cannula, where the important thing one should be aware is that the size of the cannula. Secondly, from where you're going to do a puncture. So initially what I usually do is that I just measure whether I can able to pass the catheter through this vein. So once the idea is, once you clear with this one, then you start a puncture. The puncture should be done at an angulation of 15 to 20 degree. It is an important thing. Bevel of the needle should be facing up. That is an important tip when you should do the thing. Once you puncture the skin, so this is how you puncture the skin. So then wait here, you can see in the flashback chamber, the blood has come. So this is the first point where you will see that your needle has entered, your catheter has not entered. So what you have to do is that you have to move ahead your catheter a little bit, 1 mm, and then you push the catheter. Once the catheter is pushed, you just fix with the thumb, block the catheter, and you can see a continuous backflow of the blood which is coming. So this is an ideal way of doing the peripheral vein cannulation in children. So this is how. In the next, coming to the second, the IV cannulation. Here again, this is a 6-month-old child. The procedure, the steps remains the same even in the infant. What we need to do is, what I usually like to do is that always take an help of assistant. There are other methods which are available. A lot of people, they tie a tourniquet. The problem with the tourniquet is you don't get a good counter traction. You cannot give a good counter traction in this sort of cases. So what you should do is that always tell your assistant so that it will get a good counter traction. As you see in this 6-month-old child, you are able to visualize the vein. Just little gentle tap and you can do a cannulation. So this is how you, once you puncture the skin, just go a little down the catheter, and with the pusher you can just push the catheter Once it is done, you can just see with the thumb here in this one, you can just see that you're blocking the catheter. Then you can use the flush, you flushed it, and you can see over here. So you can see a continuous flow. The fluid is going, and there is no edema or there is no extravasation which has happened. So how to fix the IV cannulation? First thing is that you can use any sort of thing. There are a lot of things are available here. You can use a tegaderm, you can use a micropore sticking, you can use a dynaplast sticking in any patient. So this is how you should fix the cannula and then apply the splint. In the next presentation, I'm going to come about how to fix the IV catheters. So again, the other method which we usually follow by a single hand technique. In this technique, what you can do with your left hand, you can grasp the grip and counter traction, and the traction is given. Counter traction is given with the index finger, and the traction is given with the thumb, so that you can visualize the vein properly. So this is how. Again, the method remains the same: 15-degree inclination, and then you puncture the vein. So this is how what we do with the single hand technique. So IV fixation is an important part of IV line insertion in the children. One has to know the basic thing of how we should fix the IV line. There are a lot of spleens are available in our clinical practice in the market to use in children. There are different sizes of the spleens are there to use in the children, whether for a neonate, whether for an infant, and bigger children. So what we do is that we use a cardboard. Then sterile drapes are available, disposable drapes. You can use that one. You can cut it, and then you make appropriate size of the splint available for the children. Once you fixed it, what we can do is first take the micropore. Once the micropore is taken, you should take 1-inch micropore. Then apply a little bit cotton over so that it doesn't fix to the skin of the patient. And first, you should use attach the middle part of the dorsum of the hand. Then take another micropore, 1 inch. You fixed it little proximal, and the last one should be fixed on the distal side. So this is how we should fix the IV catheter. This is an important thing. Where you can see in this is that all the fingers are exposed at any given point of time. If you feel that there is an extravasation, there is an edema, you can easily see through this one. If any infection or any sort of extravasation can be seen with this sort of the spleen. So this is how it should look ideally when you fix the splint. With this one, child will not be able to remove anything from his hand. So this is how you should fix the IV line when you do it. So coming to the troubleshooting, it is an important thing. You can see in this video, you're not visualizing the vein, even with the counter traction and everything, it's not visualizing the vein. What one has to know that if you're not able to visualize the vein, either you change the site. There are multiple sites which are there. You can put it in the legs, a saphenous vein, or you can put it into the scalp. But it is an important thing. One should be aware, if you're not able to visualize or feel the vein, you should not be doing the IV cannulation. You can see in this video, there's nothing is visualized. In spite of that, we are trying to, people, they try to take the IV cannulation, and then you see nothing is coming. So this is what the issue is, that here even you cannot see the vein, and then you try multiple attempts. So this is not the way of doing the IV cannulation in children. And second, there are a lot of issues with the cannulation, is that now you cannot see a continuous backflow in this one. So this is how this is not the way, because it has already counter-punctured the vein. Blindly, it has counter-punctured the vein. Second mistake, what a lot of people they do it is that they take 10 cc syringe. They take a 10 cc syringe for the flush. It is not useful to use. It is not an ideal way. So ideal syringe should be used is 2 cc, where you can see there is nothing is coming and the fluid is getting extravased. So this is not an ideal way of doing. If you are not able to find the vein, there are other alternative methods out there to see with the vein viewer, or there are a lot of trans illumination lights are there. The other things which I usually notice is that you can see in this already through this one they gave the blood and it got extravasated, and you can see a compartment syndrome in this child. So finally, if you are not able to visualize, if you're not able to fix the vein properly, then you can ladder me to this sort of complications. And then finally, we took this child for the fasciotomy, and we release the compartment syndrome. So this is how to avoid all these sort of complications. If you're not able to visualize the vein, so to avoid this sort of complication, one has to have the vein viewer in your clinical practice in children, because it is multiple attempts, multiple punctures of the vein is not a good idea in children. So in this picture, you can see you're not able to visualize anything. What we do usually, what we do, we have a vein viewer. You can visualize the vein. You can see in this video, you can visualize the vein. The procedure remains the same as I mentioned earlier. Once the vein is visualized, then you can put the catheters through this one. So it is more of beneficial in obese children, in large children where you are not able to visualize the vein viewer are the main where you can use this sort of technique or modern technique in children. So to conclude my talk, I would like to say that it is an important thing to know the size of the cannula, in which patient you should use the catheter, which size of the catheter should be used. In neonate, you should be using 24 gauge cannula. In extreme preterm babies, you should be using 26 gauge cannula, and in a bigger children, you should be using 22 gauge cannula. This is what I would like to say from my talk. And to avoid the complication, this fixation, IV fixation, which I had shown in my earlier video, should be done in that way. Thank you.